the vast majority of people are not going to become seriously ill by this. So why are we taking this so seriously as a community? Why are we locking down our economy? Why are we ruining America? You know, what's that? Explain from flattening the curve of why this has been important and maybe the challenges of getting the messages out of how we so vastly need to curtail some things.
Yeah, so I think if you look at the various different models, predictive models out there, and the University of Pennsylvania has a model called the CHIME UPenn CHIME model. The University of Michigan School of Public Health has a model out there. And it's just talking about the exponential growth in infected patients, including asymptomatic patients. That somewhere between, we got about 330 million Americans, there's some models that say 25 to 35 million of us, 10% or so, might get this virus. And of those that get this virus, somewhere in the 5 to 8 to 10% may develop more severe illness with this. Mm-hmm. It's very clear that if it stays in the upper respiratory tract, where you have a fever, cough, things of that nature, versus the lower respiratory tract where you might develop more shortness of breath, it starts to get deeper in the lungs, the outcomes there start to diverge, meaning the upper respiratory tract tends to have very mild symptoms. The more lower respiratory tract with now shortness of breath and inability to breathe as effectively, that impacts people very differently. And I think the flattening the curve is really a strategy around trying to reduce the number of new cases. And we don't know who's going to be severe, who's not going to have, who's going to get severe.
Well, we're seeing a little bit more of that with younger people, some of them requiring care that didn't really think would be as severe. So really the individual to individual, it's a little harder to predict. I think the at-risk populations are still traditionally at risk, older people, just people with other, of any age who have some other complicating factor that would be agitated by COVID-19. They're at a special risk. But yeah, you don't really know. I think that's one of the challenges is you don't really know exactly if I get this, if I'm going to require hospitalization or not.
Yeah, so I think, the health system is really the if you need a breathing machine to be on a ventilator to support your breathing because of this severe inflammatory response in your lungs. And if you have 10% of the population infected and some fraction of that's going to need this type of care, just on orders of magnitude, to have so many people potentially needing this type of care at nearly the same time creates this fear, frankly, in my eyes and in my gut about how could we care for all those people simultaneously, possibly at once.
Sure.
It's frightening. And I think that's what's got everybody that truly knows about pandemics and our healthcare, our physicians, nurses, et cetera, really concerned, is that the system isn't designed for so many people to simultaneously have to need this type of care at the same time.
Yeah. This Full Exposure podcast episode has been made possible through the support of Metro Health, University of Michigan Health, and Dr. Peter Hahn, who believe that creativity and the arts are essential to a rich, healthy, and fulfilling life.